My name is Christine Brown. I'm a nursing BSN student. Today I am going to be performing the health assessment form for Selected Systems number 1. This is Jason Brown. Jason, are you over 18 and do you consent to be on this video?
Yes.
Okay. Jason is a 45-year-old male. He is 6 foot 6 inches, 245 pounds with a BMI of 28.3. His only significant history is that he was born 70% deaf in his left ear due to a congenital birth defect. Vitals today, Jason scored a 20/20 on the Snellen chart. His radial pulse was 76, strong and regular. Respirations were even and regular at 17. Blood pressure in a seated position in his right arm was 132/86. His left arm was 128/80. Temperature was 97.3. He had a pain of 0 on a scale of 0 to 10, and his oxygen saturation was 98% on room air. We are going to go ahead and we are going to go start this assessment. All right, I'm going to go ahead and wash my hands before we get started. Okay, are you ready to get started?
Yeah.
All right, can you go ahead and hold your hands out for me? Okay, hands are warm, dry, and intact. Even tone is noted throughout. Skin turgor is a little slow to go back down. Nails are clean and well groomed. No lesions or cuts are noted on the hands. Okay, can you go ahead and look at me? Face is evenly symmetrical, ears are even, eyes are even and not sunken in. All right, I'm going to go ahead and assess your scalp and your head. Okay, hair is noted to be even and full throughout. Any pain or discomfort?
No.
Okay. No lumps, bulges, or crepitus noted. Go ahead and look up for me. I'm going to feel your temporal arteries. They are even and regular. Okay. Can you go ahead and open your mouth and close it? Okay. No popping or clicking noted. Okay. I'm going to go ahead and I'm going to press on your sinuses. Let me know if you feel any discomfort. Okay. Was there any discomfort?
No.
Okay. I'm going to go ahead and go to your ears. Ears are warm, dry, and intact. No drainage noted coming out on either side. Okay, I'm going to go ahead, pull. Is there any discomfort?
No.
How about if I push in?
No.
Okay, I'm going to go ahead and look in your ears with my otoscope. Okay, tympanic membrane was pearl gray, flat, and intact. No lesions noted. The ear canal was dry, no lesions, no swelling or redness. Right. If I can go ahead and have you take your finger, I want you to wiggle it in your ear. I'm going to say a word into this ear and you tell me what word I said.
Finger.
Very good. Can you switch hands with me? Wiggle the finger in this ear.
Toe.
Okay, you got those words correct. Right, I have a tuning fork. I'm going to go ahead and strike it. I'm going to place it on your head. You let me know where you hear the sound at.
Right ear.
Okay. I'm going to do it again, and I'm going to place it behind your ear. You let me know when you can no longer hear it.
Okay.
And again.
Okay.
I'm going to do the same in the other ear. Let me know when you can no longer hear it.
Feel it. I don't hear it.
Right. How about now?
I don't hear it.
Okay. We're going to go ahead and we're going to move down to your eyes now. Okay. If you can go ahead and take your hand, I want you to cover your eye for me. We're going to test your peripheral vision. Let me know when you see my finger come into view.
Okay. 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 Okay.
All right, we're going to switch hands. We're going to do the same.
Okay. 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 Okay.
All right, go ahead and put your hands down. I'm going to take my pen. If you could follow your eyes wherever my pen goes. Okay, his eyes followed my pen. No nystagmus was noted. Okay, if you would look at the pen, when I tell you to, if you would please look at the wall behind me. Look at the wall. Okay, look back at my pen. Look at the wall one more time. Look back at my pen. Okay? While his eyes were on my pen, his pupils were constricted. When he looked away at the wall, they dilated. All right, I'm going to go ahead and shine a light in the middle of your nose. Just look forward. Okay? White dot was seen symmetrical in both eyes. All right, if you can go ahead and look up for me. Okay, and now look down. Okay, eyes were white and clear. There was vessels seen throughout, no lesions or redness, irritation noted. Okay, I'm going to look at your eyes real quick. I'm just going to flash a light through them. Pupils were a 2. They were equal, brisk, and reactive. The irises were round. The color was even throughout. No cloudiness was noted in the cornea. Right. I'm going to go ahead and I'm going to dim the lights. And we're going to use my ophthalmoscope and we're going to look inside. So I'm going to turn the lights down. Just go ahead and look forward for me. All right, and you with your other eye, just look forward for me. It was intact. There was no lesions noted on the inside. Vessels were seen running in pairs. The disc was a creamy yellow, while the background was kind of a yellowish orange. All right, we're going to go ahead and go down to your nose. Okay, nose is warm, dry, and intact and symmetrical. Can I go ahead and get you to take a breath in through your nose and blow out? Go ahead and breathe in and breathe out. Okay, air was seen and heard going out evenly with no obstruction. I'm going to go and take my otoscope with a different nodule, and I'm going to look inside of his nose. Okay, mucosa was red, intact. No lesions, no swelling noted. Turbinates were they were intact, they were not swollen, and there was septum was in the middle, non-deviated. Now I'm going to go ahead and I'm going to go to your mouth. Lips seem to be dry and intact, no lesions noted, no crust, no breakage. Okay, can you go ahead and open your mouth for me? Okay, can you touch your tongue to the roof of your mouth? Very good. Can you stick your tongue out for me? Okay, open up and say ah. All right. The mucosa was wet, moist. It was intact. It was pink. Uvula rose to the midline when he said ah. He was able to touch his tongue to the roof of his mouth and able to stick it out. Teeth were intact. No cracks noted. Gums were pink and moist. The palate on his mouth was intact. There was no openings in there. His tonsils were noted in the back, graded at about a 2. We're going to go ahead and we're going to move down to his neck. His neck looks symmetrical. I don't see any bulging out. I'm going to go ahead and feel for his lymph nodes. Let me know if you feel any discomfort. Can you bunch your shoulders up for me? Okay. Skin was warm, dry, and intact. I did not feel anything, any nodes sticking out. Was there any discomfort for you?
No.
Okay. I'm going to go ahead and feel his trachea. Okay. Trachea was straight, no deviations noted. I'm going to go ahead and feel for his carotid pulse. Okay. Pulse is strong and intact. I'm going to go ahead and feel for the other one separately. Okay. Pulse is even, strong, and intact. I'm going to go ahead, put my stethoscope on. Can you go ahead and take a deep breath and hold it in for me? Okay, go ahead and breathe. Take a deep breath and hold it in. There was no bruise heard. All right, if you would, go ahead and take your head and tilt it all the way back. And go ahead and tilt it down to your chin, to your chest. All right, look at me. Turn your head all the way to the left and turn it to the right. Go ahead and shrug your shoulders for me. All right, now we're going to do it against my hand. All right, and shrug your shoulders. Okay, there was good resistance, muscles felt strong. All right, if you can go ahead and hold your arms out for me. Okay, go ahead and move them down, out, up, behind your head. Okay, go ahead and flex your hands up and down, and go ahead and rotate them. All right, go ahead and squeeze my fingers. All right, hold your arms up and go ahead and pull against me. All right, and turn your hands around and push against me. Okay, muscles felt strong. He was able to move around good. I'm going to have you take a drink of water. And when you do that, I'm going to feel for your thyroid gland. Go ahead and take a drink. All right, thyroid gland was felt. It moved up when he swallowed and then moved back down. Set this right over here for a moment. Okay, we're going to go ahead and we're going to look at your chest. I'm just going to straighten your shirt out a minute. Okay. Skin is even toned. It's warm, dry, and intact. No lumps noted. Was there any tenderness for you? Okay. I'm going to go ahead and I am going to percuss. If you could, go ahead and say 99.
99, 99, 99, 99.
Okay, fermentus was felt evenly throughout. All right, I'm going to go ahead and I'm going to listen to you breathe.
Excuse me.
Okay, breath sounds were even, slightly diminished in the bases. Right? You can go ahead and take a deep breath in for me. Let it out. Okay, breaths were symmetrical. All right, sir, we're going to go ahead and have you turn around and I'm going to assess your back. Okay, skin is warm, dry, and intact. Even tone noted throughout. Shoulders are symmetrical. Comes down at an angle. Okay, is there any tenderness, sir?
No.
Okay, no lumps noted. No breakage in the skin, no lesions. Okay, I'm going to go ahead and I'm going to feel down your spine. Let me know if you feel any discomfort. Any discomfort?
No.
Okay, spinous processes were intact, they were felt, even straight line going down. Okay, if you can go ahead and repeat 99 for me.
99, 99, 99, 99, 99, 99.
Okay. Fermentous felt throughout. Okay, can you go ahead and take a deep breath in for me? And out. Okay. Breaths were symmetrical. I'm going to go ahead and tap on your back. Let me know if you feel any discomfort. Any discomfort? How about right there?
Nope.
Okay, I'm going to go ahead and percuss down your back now. Sounds are resonant and they got a little duller towards the end. I'm going to mark a line right here. And another line right here. Okay, and the lines are even and symmetrical. Okay, I'm going to go ahead and listen to you breathe. You'll just take some deep breaths for me. Okay, breath sounds were evenly noted, slightly diminished at the bottom. I'm going to go ahead and move my supplies. Okay, sir, if you could go ahead and lay down. You can have your hand right here, feet down here, and he's at a 30-degree angle. I'm going to go ahead and move to the other side. Okay, I'm going to go ahead and assess for his pulsations. Okay, I do have a light shining down here to see them better. I do see pulse in here, goes down to the midclavicular notch. And I can see it on his left side as well. Okay. I'm going to go ahead and we're going to assess your heart. Okay. First, I'm going to look for any heaves or thrills. No heaves are noted. No thrills are felt. Okay, I'm going to go down the midclavicular notch and I'm going to feel for your apical impulse. It is soft and gentle. Okay, now I'm going to go ahead and listen to your apical pulse. I would listen to this for a full minute, noting rate, rhythm. Apical impulse is heard, it's even and regular. Okay. I'm going to go ahead And just feel for a minute for any thrills noted throughout the heart. Okay, no thrills were felt. I'm going to go ahead and listen to your heart. Okay, S1 and S2, love dub, were heard. There was no extra sounds noted, but I'm going to double check again with my bell to make sure. Okay, sir, if I can go ahead and have you lay onto your side. I'm going to listen to your heart one last time just to make sure I don't hear any irregular sounds. Okay, you can go ahead and sit up. Okay, no extra heart sounds were noted, no murmurs were heard. Thank you very much for letting me assess you today. And that completes this assessment.